So our agenda today will be, we'll have an overview of the ACA employer requirements, some must-knows about preparing for the IRS filing deadlines as well as being unprepared, action items for ACA compliance, benefits of our product, obviously, and then we'll have the Q&A. So we're going to have some PowerPoints reviewing for about 15-20 minutes the ACA laws, which you may be pretty familiar with by now or maybe not. Hopefully you'll pick up some good stuff. And then we'll have a live demo of our solution at that point. So integrity data, we've been around since 1996. And then that makes us 19 years in business. We're in 7,500 organizations worldwide. We've been engaged by Microsoft to author payroll and human resources upgrades to their Microsoft Dynamics GP line. We've developed 29 products in the last 19 years. But from an ACA viewpoint, we've been immersed in ACA compliance software since 2012, which is almost the beginning of time when you think about ACA software. So we began by being engaged by a major restaurant company. They have 36,000 W-2s, and they do use our software now. And from there, we started drilling through all the IRS meetings. We attend every IRS ACA-related meeting there has ever been since 2012. We began getting all the requirements of the law together. We finally released code a year later. And the first commercial version was released and installed after just 2 weeks after the IRS issued their final regulations. So we kept pace with that. We added the commonly controlled or affiliated group combined reporting capabilities. And we produced the first 1095-C form 4 months before the actual draft was finalized by the IRS. So this is all just to say that we've been immersed in the ACA compliance. We're on a target. We always create updates right away, immediately after any determinations, and we still sit in their reviews. Okay, so what's the ACA compliance burden on employers? So the key thing is, the 1095-C, and you may think of the 1095-C as an annual report, which it is. It's an annual report, but the information, which is important to note here, is by month. So you have to track the information on a monthly basis, even though it's only reported annually, and that's a monthly reporting of annuals. You can see down here between June and July there's a change in codes, so that's what I mean by the reporting on a monthly basis. It's not like the W-2 where it's just a summary of information or the 941 quarterlies. So what must you do overall as an employer? So annually, you've got to produce the 1095-C. The 1094-C gets uploaded to the IRS, or it can be printed out. And you've got to determine the applicable large employer status and that number. Monthly, you have to calculate employee eligibility for the offer of coverage, track the cost of that coverage, and track the affordability of that coverage. Of course, continuously, you have to track every employee's hours of service. So it's not just their paid time. It's not just paid hours of work on the job. It's how they define hours of service. So hours of service would include all these items on this list here. That would be jury duty, military deployment, FMLA, whether they're paid or unpaid. Now part of that burden on employers is to track those unpaid hours in addition to the paid hours. Got, leave of absences, vacation, holiday, sickness, incapacity, layoff. And one thing about, the layoff, they really haven't fully defined what a layoff is from an ACA viewpoint. The IRS will be making updates. Our solution is a Microsoft Azure cloud solution. So any determinations they make within 2 weeks, you will have that compatibility, compliance regulations built right into the software. You don't have to upload any hot fixes. You don't have to upload any service packs, major release information, etc. So who should produce the IRS 1095-C? Well, it's every employer with 50 or more full-time employees. or full-time equivalents. And then every employer who is self-insured, regardless of the number of employees, have to provide those. Now, originally, earlier on in the year, a lot of people were thinking it was 100. That was a little ambiguous. This Tim Berger from the tax law specialist at the Internal Revenue Service, he put out a notification in May that says really it's everybody with 50 to 99 this year has to file that report. So that's a little bit clarification there. Now, who should get this? So it's every employee whose hours of service, not work hours, total 130 hours in any 1 month of the calendar year. Now, that's using the monthly measurement period. And we'll talk more about the difference between the monthly and the look-back measurement period as we go along. Secondly, employees in the stability period, and that's for those who are using the look-back measurement method, were found to be full-time. And then, of course, any employee who is on an employer-provided health insurance plan, self-insured, even if that employee was not full-time in any month of the calendar year. So for self-insured, you have to provide 1095-Cs for every employee in your company. Some must-knows about preparing for the IRS filings. Okay, well, here's the dates. Everybody probably knows these dates. February 1st to the employees, January 29th for the 1094-C to the IRS for people with less than 250 1095-Cs that go out to the employees. If you have more than 250, you are required to file electronically the 1094-C. And that is one thing that Microsoft Dynamics GP, if you're using that, does not do. Now, our software will work with any software system. SAP it'll work with, Oracle it'll work with, NetSuite, Intact, QuickBooks, you name it. We can produce the 1094 or 95Cs with any payroll system and any software. But we do have obviously expertise in the GP world, and we work with that also. What's some must-knows about not being prepared? Okay. Well, the key one is, if you think, and you're a company who's always offered really good insurance, it's affordable to the employees at their cost level, and to everybody, and they all take it. You may think that, well, it doesn't apply to me. I've met the regulations of the ACA law. Not the case. You still have to file. You have to do that extra burden of filing those forms, or else there's a $5 per required form for not filing. And that's the sledgehammer part of it. The tackhammer part is, there's a penalty for offering no coverage, and there's a penalty for offering non-compliant coverage, and there's some exceptions, and some they give you a little room this year of 80 employees are exempt, etc. So that's a lesser amount of penalty, but there is a penalty on that. So if you're you need to be aware of that. If you are an ALE of 50 or more, the IRS reporting is not optional. It's a federal requirement with penalties attached for non-compliance. You need automation to connect all the data points accurately, and fines, which can be significant, they're not deductible business expenses. So let's talk about these two groups which you may fall in. One group is the one I talked about where they offer good quality health insurance coverage. They've always done this. They've got a pretty stable workforce, mostly salaried or full-time 40-hour hourly people. And they're pretty much in compliance with the ACA mandate for the affordable coverage to be offered. So that group they're burdened, and they're actually the majority of the companies. Probably 95% of the companies fall into that group, but they still are burdened with all this reporting and tracking. Now, the forced minority is the smaller group, and they have to, they're offered limited health coverage or maybe no health coverage. Their workforce is defined by, mainly hourly workers with varying schedules, high turnover, low-wage workers, and you could think of like the restaurant industry. You could think of the healthcare industry in the, like nursing homes, assisted living, etc., and those types of jobs. And there's a lot of other industries. But if you think about, the restaurant industry, there's varying schedules, a lot of part-time hours in there, high turnover, lower wages. So what's the reporting requirements for each category? Well, for the majority of the people, they must document the hours of service for every employee, the offers of coverage, as well as the attributes of that coverage that's been offered. For the minority of the group there, again, they must document the hours of service. They must identify the employees that are eligible for offers of coverage really on a monthly basis. They must document those attributes of the covered offerage as well as test for the coverage offered that it meets the ACA standards. And then the reporting needs, actually both groups have to report, submit the 1095-C to employees and the 1094-C with the IRS. In addition, the restaurant business, etc., forced minority, they have to do monthly internal reporting to identify newly eligible employees, and they must do monthly reporting to test the affordability of the coverage that is offered on that. So that's a lot about the basics of what's required. I don't go into all the is that are maybe more complicated around tribal groups, people who are on ships, the educational professors, etc., how you do the FMLA, etc. We can all cover that, in a second session. But today I'm going to just talk about what we offer and show you a demo of our solution. So here's how we do the heavy lifting. Think of the top half of this circle as the compliance side of the circle, and then the bottom half is the integrity data side of the circle. So for penalty and risk management, we offer affordability testing, as well as eligibility tracking. For the IRS form submissions, we offer the ability to print the 1095-Cs or, at an optional cost, emailing the 1095-Cs, as well as the 1094-C printing if you're under 250 employees, or the electronic filing of the 1094-C for those over 250. If you buy our software and if you have less than 250, yes, you'll be able to electronically file the 1094-C. An interesting note, 2.5 weeks ago when we met with the IRS specifically about the certifications for the uploading of the 1094-C, they mentioned that at that time there was only 5 companies in the United States that had completed and been certified for the 1094-C upload. We were one of the 5 companies, and I'm sure everybody else is scrambling to get that done. It was a lengthy process, but we do have that certification, as well as they certified our software as being a 1095, or excuse me, our software being certified as ACA compliant as well. Now on the side of the integrity data implementation, ours is quick to deploy. We have no HR implementation required to deploy our software. It's good for any ERP system, as I've mentioned. We have we automatically keep the information updated. We provide alerts and notifications in a dashboard fashion. And then we have well-trained staff on the ACA Fluent Support. Our director of ACA Compliance has really designed this software. He wrote many pieces of the software. He knows the laws inside and out, attended every IRS meeting there has been since 2012. All right, so regulatory reporting. This is what we do. We provide this with our solution. We identify all the employees who need to get the 1095-C. We populate the forms, regardless of which eligibility method is used, whether you're on the look back or the monthly. For the self-insured companies, we populate the Part 3 of the 1095-C. We support employers with a pay strategy. At the year end, we distribute the 1095-Cs to your employees. At the year end, you can distribute those. We don't distribute those. You can print those out from our software is what we're trying to say here. As well as if you purchase the email option, then those can be emailed out based upon the employee's consent signing. So what about the 1094-C? We generate that form for the IRS. We e-file that right from within our software, and you will get a notification as to whether it's successful or unsuccessful, a confirmation from the IRS when that's been completed. And generate the form that meets the IRS consolidated filing requirements for commonly controlled and affiliated groups. For penalty risk management, we constantly monitor the employee's eligibility for coverage. So we mine your data basically, and we look for any breaks in service. We administer the rules of parity. We give notifications as to when someone becomes eligible, month-by-month basis. We forecast which variable hours employees are trending toward full-time status. We have monthly tracking by employee of the offers of coverage, as well as the ones who have waived that coverage. We have testing for affordability of that coverage, including the safe harbor calculations. For business intelligence tools that's included, we have dashboards, notifications, alerts, and you'll see that when we demo the software. And we have the automatic updates of software all included in the price of the software. So let's take a quick look at how long does it take for us to get our software implemented. So it's the responsibility of the employer to work with our spreadsheets to be able to come up with the data that needs to be imported into our cloud solution. But once that data is imported and we schedule an implementation, which we schedule within 5 days of payment of the software, it's usually less than a day. It's not weeks or months because we don't do any HR deployment. In the first hour, we can get the key configurations set up and run the basic ALE report as well as the standard report. So why is this quick? Well, we've got good code and logic in there. It makes it work without the need of a full-blown HR implementation. It contains everything that you need to be compliant with the ACA right within the software, and it's easy to set up. Okay, so I'm going to switch over and do a demo of the software. So this is when you log into our software. It's a simple login. You can have multiple users. You will come to this opening screen, which is our dashboard. We have the dashboard area, which is different alerts and notifications about the system and what you need. And then the bottom part is some RSS feeds, which you can customize. Comes with our feeds in there to keep you up to date with what we put out there on blogs, etc. So if you look at the dashboard, you can view the alerts right from here, or the reports that's involved with calculating these numbers. As I logged in, you could probably see it was spinning up the calculations for all these different alerts. If you go into the system now, we're going to drill down a little bit. So if we go into the alerts, you'll have all your alerts listed in here. I don't have any of my sample data set up yet. But the key thing here is you can mark them as completed or even dismiss the alerts. You can actually query right here to get new alerts while you're in this particular window of that. So let's take a look at some of the reports. Obviously, the key report that we're going to be doing is the 1095-C. And you don't see the 1094-C on that list yet because the final determination from the IRS has still not been made, and this information will be part of our year-end release coming out in December. Once the IRS gets every last field buttoned up the way they want it, we'll be able to release our year-end release, and then you will be able to choose the 1094-C for uploading at that point in time. Of course, that just comes transparently. When we get that done, it'll be loaded into our cloud version here, and you'll just see that in your window here under Forms. So let's look at the 1094-C quickly here to start with, and how easy that is to produce these. I'm going to just select one employee instead of 300. And we're going to select Riley again. Select the correct year and print this. So here's the 1095C that we've come out with. The top part is employee demographic information. The bottom part is for self-insured. It would list all the dependents, their social security number, date of birth, etc., and then what months they were covered with X's in the boxes. And by the way, we populate all the X's, all these codes and these values in this middle part 2 section automatically, so you don't have to worry about the codes or if they're correct codes. We've taken that completely out of your hands, and we've created the code to be able to correctly, according to compliance, put in the correct codes. So line 14 is around the offer of coverage, the eligibility side of it. Line 15 is the employee share of the lowest cost monthly premium. That's for self only. Now, we'll get into this a little bit more when we set this up and show you that. But for ACA compliance, all they care about is one plan that is affordable, has minimum coverage, and then what the cost of that is. So when you run your safe harbors, it will determine whether that was affordable calculation at each individual person. And then the safe harbor section here for how you determine affordability is down here. All right, so let's drill down a little bit and start looking at how we get this set up to get these numbers and how all this works. This is kind of the end result here. So let's go back and see how we get there. All right, so you're going to be able to identify benefits and pay codes. We'll just select the pay codes a second. So part of the setup here, you're going to have to put in all the pay codes that your system has for transactions. And of course, this is hours of service, not just paid hours. So you'll part of the initial implementation, we'll get these set up. Once we get these set up, now we have all the hours in the system. We can determine ALE numbers. We can determine eligibility criteria with that. A couple things at the company level I'll point out. So for the company setup, you're going to set up a standard measurement period, and really you're going to have one for every year, for every measurement period, because there's new date ranges, etc., to calculate this. And then, if you have a control group, you'll put the default one in here. You could have multiples, or you can't have multiples. You can have multiple companies under one control group. And then we do support the look back and the monthly measurement period. And you can, if you need to, mix these up, but one company can be, if they're all salary people in that company, mainly your staff, you could use monthly measurement for that company, and then for other companies, which may be, like in the restaurant business, that would have all the employees that actually work in the restaurant, et cetera, your part-time and full-time people would maybe fall under, be more advantageous to use the look-back measurement. Now, the look-back measurement is really a friend to use to you as an employer if you have a lot of variable employees. Okay, other things is, we identify the federal poverty line because that's one of the safe harbors, what the percent is this year. You may hear two numbers here, 9.5 and 9.56. 9.56 is actually what the law has determined. However, the IRS did hard code 9.5 in that early on. They're visually scurrying to be able to make that a variable field, and that code will be coming out, they hope, by the end of the year. Next year, by the way, that number will be 9.66 on that. And then there's other setup things which we can go over during the actual implementation if you purchase our software around seasonal workers, educational organizations, professors, etc. On that particular part. So let's start drilling down into the standard measurement period for the look-back measurement method. Let's take a second to fire up. Okay. I'll select the one I've got set up in our demo data. So the monthly measurement period, that just basically says any month that you have 130 hours, any employee reaches 130 hours, you then have to offer them coverage and then keep that coverage for the length of the stability period, which is a year. And that works really well for full-time salaried people. You know, you only have a few part-time people in your organization. But if you have any level of part-time people in your organization, you definitely want to use the look-back method, which is this particular method. So what are the key components of the look-back method? Well, again, you can you have to choose, you know, what your date range is, because, you know, this is looking up, you know, data based upon the hire date or the first day of the next month. And the information I'm going to show you today is really around what most companies do set up. Obviously, there's some companies that have valid reasons for setting it up differently, but I'm just going to go with what the majority of the companies use for a setup. So the first day of the next month would be typical, and that is because insurance companies, when you offer health insurance coverage, they always start their health insurance coverage on the first day of the next month. So this is the standard measurement of the period dates. All right, so we have three periods to set up. One is a standard measurement period. This is in my example here, 12 months. It can be 6, 9, or 12. Typically, it's 12 months. This is a qualifying period. So during this 12-month period, this is a kind of a pass-fail. This is a list of employees who have been employed for the full duration of this period. And then there's an alternative method for anybody who gets hired outside of this period. For example, like this starts on 10/1. So if you got hired on 10/15, the new hires, they would fall under a different measurement type, and that would be an initial measurement period, which we'll go over in a minute. So we have this 1-year time frame that their data is analyzed, and there's a report that comes out and says, all right, you've got 100 people that are full-time. You maybe got 50 people who come out as part-time. So, you know, there's your ALE number that you're going to use. So if you think of the 2015 data, depends on when your insurance policy starts, which, by the way, the stability period is typically synchronized and should be synchronized with the year of the insurance company policy. So if your insurance company policy enrollment and starts on January 1st and runs through December 31st, this is what the same dates that you would want to use for the stability period. So once you pass or fail the full-time or full-time equivalent qualifications of the standard measurement period, then you have up to 3 months, 1 to 3 months. I've chosen 3 here because that's your advantage. And for an administrative period. So these people that meet this requirement, now you've got 3 months to offer them affordable minimum coverage. Obviously, you're going to be running the reports after you complete your payroll. You need some time to do that. Obviously, do the paperwork, etc. Make the offers. You know, let the employees get back to you. But the IRS gives you up to 3 months to do that. And then all the people who accept that insurance, they have to be provided that insurance that you offered for the full length of the stability period, even though they may fall under the part-time period in the next measurement period. You still have to provide that insurance for the full year of the stability period on that. So as you can see here for 2015, if you had this time period of January 1st of 2015 through December 31st of 2015, your measurement period would be back a year to maybe 15 months earlier. So you will have to provide data going back sometime in the 2013, 2014 range to be able to come up with your ALE number and determine the full time. These reports are required if you ever get audited. All these reports will be required. You have to validate your numbers, and we'll look at some reports here in just a second. Now, I mentioned if you fall out, the rule is you have to be employed for the full length of the standard measurement period. So if you get hired on 10/15 you're allowed to set up an initial measurement period. And again, that would typically pattern after the standard measure, the other look-back measurement period sections. Although the administrative period for new hires is only allowed a maximum of 1 month. Again, the first day of the hiring. So you got two groups. You know, the ones who've been full-time all the time. Now this ACA law is starting. You're going to look at 2014 data basically and come up with, all right, these guys are full-time. They should have been offered coverage. They probably have been. And now the 2015 report, you can do that because you've met those requirements. Anyone hired after that initial standard period, then they would have a report here to see where they come into play. So let's look at some of those reports. And this is around eligibility again. So the first one we're going to look at that's required is the report for the FTE's full-time equivalents for the ALE, which is the applicable large employer number. And so we are going to select the right year. Okay, so down at the bottom, this number that comes out 105, this number actually, we calculate this number, we put that on the 1094-C, which has to be uploaded to the IRS. There's a box for this number. So you may realize you have over 100 and say, well, I don't need this number. Well, if you're ever audited, then you have to show them this report to show how you calculated and came up with that number that came on the 1094-C. We do all that for you. You can look at this report if you're on the borderline. You can say, well, I got 49. Wow, if this number comes up with 49, hey, you don't have to do anything. If it comes up with 50, you got to do everything. Okay, and again, this is monthly. So how this works is full-time employees. So in the ACA world, anybody who works and is hired in, and you know they're going to work 30 hours or more in a week, you just designate them as a full-time employee. So if they're hired in, you know they're going to work 4 days a week at 32 hours, then you'll just be designate them as full-time employee, and they would end up in this hero column as full-time. Secondly, you have the group of people who are greater than 130 hours, and these are variable or seasonal employees that in the month of January they have come up with more than 130 hours, and there's 20 of those people. Now everybody else who came in with less than 130 hours individually, then they are all thrown in a bucket together. And then what we do is for FTE, for a full-time equivalent, we take that number of hours and divide it by 120. And you may think, well, why isn't it 130? Well, during the passing of the law, they had to make this so it pays for itself, and 130 didn't pay for it, according to the Office of Budget Management. So they dropped that number down to 125, down to 120, and 120 is the number they came up with, which would make the whole system work, and that's why we divide by 120. And then we come up with 34 employees out of this group of total hours. And we got 83. Then we do this every, this is done every month. This is why we have to have monthly data. Includes those hours of service as well. And then you divide that by 12 and you come up with 105. So this is the ALE report. Let's go look at the next one. I'm not going to show you all these reports, but we'll just walk through a few of them for the key reporting here. As you can see, these reports are pretty easy to get up and going and to run these reports by periods. Okay. Analyzing the data. There we go. Okay. What we got here on this report is the standard measurement period. So think of this as like that 2014 data time period, that year that have the pass-fail. So if you take 30 hours per week times 52, you come up with 1,560 hours in a year. So anyone who worked 1,560 or more hours during that year, that trial standard measurement period would be classified as full-time. So you can see Terzo is like 1224, so they're part-time, don't have to offer coverage to them. Claude is full-time because he's over 1560. So this is the initial testing period. And of course, next year there'll be another test period, and that will be on the 2015 data. And then this is where your initial starting place is for the ones who work full-time, etc. And if you're using, as you go along through the year in 2015, and those are offered coverage as it should be, and of course 2016 will be, you'll have all this to work with to make sure you're compliant, offering them all this information at the right time. So let's look at one more. And that was, for the ones who met the full criteria of the full year. So let's look at the initial measurement period. This gets to be with the new hires now. Okay, now this group here is, keep in mind this is a 12-month period, so this shows you how far along they are in their initial measurement period. So this person was hired 11 months ago. And basically, you got 12 months to make the analysis. And they're at 1,088. Well, they're not going to get to 1,560 in the next month. So yes, Jocelyn will be a part-time person. But you got here Merlin has already worked in 7 months, 1,058. Yes, they will make, they're trending toward being full-time. So this gives you some ability to run some analysis. You have the ability to, out of your browser, export this exact report information out to an Excel file. You can do, if you're a very large company, you might do some analysis trying to get an idea of what your insurance cost is projecting to run in the year. So all this data is available and easy to use and export out into Excel to make more management decisions there. Okay, other reports in terms of eligibility area is the monthly measurement period is just like the previous report, except it'll only show the people who actually came across as full-time, and that will be the list that you use to offer coverage to. So you'll run this monthly report every month and use that list to come up with the people you need to offer. There's also a report on employee health coverage. At the employee level, we have several reports. And monthly hours breakdown. This report is one of the first ones that the IRS will look at, because this shows how many hours per month that the employee had, whether if they're in the monthly measurement period, whether that was 130 in any particular month. Did you offer them coverage that month that they reached 130? That's the kind of things that we're looking for. We provide that, as well as all the employees who have coverage and all the employees who do not have coverage in here on that. Okay, now I'm going to go back, and before I go into the affordability side, I'm going to show you a couple utilities and upload and import. So we have 3 spreadsheets. If you're self-employed, you will need to put together dependent information and upload that. So all these spreadsheets, you can use them to upload at any point in time. Or if you want, once the main 2 years worth of data is uploaded in the system and you're up and running, you may want to add an employee right here in the system manually, or you can put them in that same spreadsheet and upload them. Same with dependents if you are self-insured. Payroll transactions, though, need to be uploaded at least once a month, and that data will come from your payroll system. Whether that's ADP or GP processing or paychecks, or maybe, and some companies are actually using their timekeeping system like Kronos to pull most of that data. At any rate, you typically would create an automated process to get those transactions. Likely you would upload those every pay period. You don't have to. At minimum, since it's monthly reporting, you would have to upload it at least once a month for the analysis to happen for eligibility. So these are the upload and import data. All right. So let's go back to another part of the configuration and talk about affordability. We'll spend a couple minutes on that. And then we'll open up to questions and answers again. One thing before we go into the affordability side, you can set up waiver codes. You can mark the employees under the employee maintenance up here, whether they have wavered for, if you offered the coverage and they wavered, you can track that. You can also exclude active employees if they qualify for exclusion, maybe seasonal workers, etc. You can also put in FMLA, so you can enter in the start and end date of a FMLA for an individual, and then our calculations will take into account those 4 weeks that they may be off to come up with the correct average hours according to the rules and regulations of ACA. And you can set up your control group if you have multiple affiliate ownership or combined group reporting requirements. So let's look now at the plan that determines lanes 14 and 15 and 16 in the affordability part of the 1095C. So a little bit about the health plan. So you're going to have a code out there for a single person health plan, and then that should be affordable. If you want to be compliant and meet minimum values, which you can get that information from your insurance companies, they should be able to easily say this plan meets the minimum values and the essential coverage according to the law that's put on the insurance companies. So what you're going to do, you got this one code, and of course, we know if the employee, we use benefits. Again, I mentioned benefits. And you can think of a benefit as a deduction code or a benefit code in the benefit world. And those would only be, for your health insurance. So let's take the example. You've got, 9 codes. You've got a good, better, best plan, maybe different providers. Single, you might have single plus one, single plus spouse, single plus family. We don't care about all 9 of those codes. All the ACA world is looking at is one code for single employee that has minimum value that you can offer them. It doesn't have to be a deluxe plan. So in our system, if you have 9 codes, you will designate all the 9 codes, and we will know that any group of those would fall under the affordability because the single coverage is affordable. So if you're using just one code, that also works because you're going to put the rate for the single one here. So if you use one code called insurance and then you change the deduction amount based upon family or spouse, etc., what you're tracking here is a single. So either way works with our system. So let's look at I'm going to do a new record here real quickly, and we're going to look at some of the drop-down lists here. So is this a qualifying offer? Yes or no. So you're going to mark whether that's a qualifying offer. You can say no, it's not a qualifying offer. I'm just going to, for whatever reason, maybe you've determined that it's, you're only going to have 1 or 2 that for penalty sake. You just have to run that calculation. Almost all the people will have a qualifying offer. So that's what you're offering is a yes on that. So this is a standard. It's a qualifying offer. You're going to say, yes, it's a minimum essential coverage and has minimum value. And then we offer this for the employee, the spouse, the dependents in this situation. So our health insurance coverage is for all employee, spouse, and dependents. Again, we're only looking at the employee side of it, and which is represented over here in the cost for the employee one. But these 6 columns here determine the codes that get entered in line 14. So based upon your setup here for this plan, we can determine when, based upon when deductions start being taken out of their paychecks, etc. We can also track if you fully pay for it, we would use a benefit code, and we could determine when that benefit code takes place. So this is all automated. You don't have to worry about codes, which ones are right, which ones are wrong. Remember, the IRS has certified our software as being compliant. ACA compliance software. So for line 15 and 16, the line 15 information is hereby designated by what the particular cost of that single employee insurance is to the employee. You have an interesting thing here is when they pass the law, you have to be the 9.56% or the 9.5% of the employee cannot be paying for more than that of their 1040 income, adjusted gross income. Well, employers don't have access to the 1040, so the IRS had to scramble a little bit and come up with safe harbors. So you've got 3 of them you can use. You can use the W-2 income, box 1, and we calculate that as the time goes on, give you alerts whether that's affordable or not based upon the 9.56%. A rate of pay is the most commonly used by the majority of companies, and that is the lowest rate of pay during the year. And then you can also use the federal poverty line, which is at $11,770 times 9.56%, and that comes to $93 and some change. So if you're using the federal poverty line and you have a policy for a single that costs the individual less than $93, you will be affordable in terms of line 16 codes. So this section here is what is used to determine all the line 16 codes as well as the line 15 values on that with the setup. Of course, the transactions will bring about the deduction benefit codes as well as all the pay codes for eligibility on that. Okay. So what I want to do now is go back to the PowerPoint. I think again we can only stress that we got 48 days left. We are booking in now the second week of December. Our schedules are getting pretty full. If you look at our implementation schedules on the system, and as you can see, if I bring this over here, just a quick look at our implementation schedule. That's this week. That's next week. We're getting in the first week of December. As you can see, it's pretty much booked up totally. And then the second week is starting to fill in. So I just wanted to mention that. Obviously, everybody knows they have to do something, and they need to be making decisions, which is real important.